Welcome to the medical education video. My name is محسن George Khalaf. I'm a general and laparoscopic surgery consultant, member of the Scientific Council of General Surgery of the Egyptian Fellowship Board. This video presentation is on medical ethics. I have nothing to disclose as regard this presentation. After this short video, you will be able to define medical ethics, to recognize the components of medical ethics, to identify why medical ethics is not assigned a major role in the medical school curriculum, and finally to classify the principles of medical ethics. Then what is medical ethics? Medical ethics is a system of moral principles that apply values and judgments to the practice of medicine. There are several components of medical ethics. The first one is the physician-patient relationship, which we are going to address in this short video. Other components are the physician-physician relationship, the relationship of physician to the healthcare system, and the relationship of physician to the society. Then why medical ethics is not assigned a major role in the medical school curriculum? This is because of several wrong concepts which are still being believed. As long as the physician is knowledgeable and skillful clinician, ethics doesn't matter. Another wrong concept is that ethics is learned in the family, not in the medical school. Another point, medical ethics is learned by observing how senior physicians act, not from books or lectures. Finally, ethics is important, but the curriculum is already too crowded and there is no room for ethics teaching. There are 4 basic principles of medical ethics, namely autonomy, non-maleficence, beneficence, and justice. The first principle is autonomy, the right to choose or refuse treatment. Patient has freedom of thought, intention, and action when making decisions regarding the healthcare procedures. For a patient to make a fully informed decision, she or he must understand all the risks and benefits of the procedure and the likelihood of success. And for a consent to be valid, it must be voluntary, it must be informed, and the person consenting must have the capacity to make the decision. Always respect the autonomy. However, sometimes this can be difficult because it can conflict with the paternalistic attitude of many of the healthcare professionals. The second basic principle is non-maleficence, which means do no harm to patients. Make sure that the procedure does not harm the patient or others in the society. Physicians are obligated not to prescribe medication they know to be harmful. Some interpret this value to exclude the practice of what's called euthanasia. To summarize, non-maleficence means to follow patient safety goals and standards. The third basic principle is beneficence. And beneficence means the practitioner should act in the best interest of the patient. The procedure be provided with the intent of doing good to the patient. This needs healthcare providers to develop and to maintain skills and knowledge by continually updating and training. The fourth basic principle of medical ethics is justice, or in other words, equity. This principle addresses the distribution of scarce health resources and the decision of who gets what treatment. When we speak about equity or justice in healthcare field, there are 2 different aspects. One of them is equity in health. And equity in health means that the use of health service is driven or determined by the health needs rather than other factors like the capacity to pay, geographical location, or anything else. The other aspect of equity or justice is the equity in healthcare financing. Equity in finance is measured in terms of the amount of health-related payment or financial contributions a person makes relative to their capacity to pay. Still, we have other principles of medical ethics beside the basic 4 principles. Confidentiality, fidelity, based on loyalty and trust. Maintain the confidentiality of all personal, medical, and treatment information of the patient. Another principle is the honesty, veracity, truth-telling, telling patients what they need to know. There is an obligation to full and honest disclosure. The final principle is dignity. Respect to human dignity is the cornerstone of all other principles of medical ethics. Now, after finishing this short video, I hope you are able to define medical ethics, to recognize the different components of medical ethics, to identify why medical ethics is not assigned a major role in medical school curriculum, and finally, to classify the principles of medical ethics. Before ending my presentation, I need to refer to a quotation of Hippocrates 400 years before Christ. He said, "Whenever a doctor cannot do good, he must be kept from doing harm." Thank you very much.